Hi, everybody. Today is September the 30th, 2021, and you're watching a Herald-Republic Editorial Board meeting with the two candidates for District 3 position on the Yakima County Commission. LaDon Linde, who's held the post since being appointed in November 2020, and his challenger, Torres, who runs a contracting business with her husband and is a newcomer to politics. I'm John Taylor, the YHR's opinion page editor, and joining me are executive editor Greg Howling, city editor Joanna Markell, and our county government reporter Phil Ferolito. So let's meet our candidates. Ms. Torres, just take a couple of seconds just to introduce yourself.
We can't hear you.
Can't hear?
We're not hearing anything. Sorry about that.
Oh, no. Can you hear me now?
Yep.
Okay. So I'm running for Yakima County Commissioner. I'm 44 years old. I have lived in the Yakima Valley all of my life, and I am excited to be here today and talk with you guys.
Great. Commissioner Linde?
Yes, good morning all. My name is LaDon Linde. I am District 3 County Commissioner, as Mr. Taylor mentioned, since November of 2020. I live in the Sunnyside area. I'm a graduate of Granger High School. Lived in this area for 45 years now. My wife and I, Sandra, have been married for 38 years. We have 6 children and 10 grandchildren. And my background is 20 years in agriculture, the family farm, all 15 years in healthcare at Sunnyside Community Hospital. Also spent a lot of time volunteering in my local church. And so it's given me a variety of management and leadership positions over the years. Thank you.
Very good. So let's go ahead and ask a few questions here. We'd like to ask a few basic questions that get at some of the core issues that are facing our county. Each candidate will get a reasonable amount of time to answer, and their opponent will get a minute or two to respond after the fact. So Commissioner Linde, I'll begin with you here. First question is, you have both candidates have been critical of the county's recent settlement of the One America lawsuit over county commission elections. In your view, what's wrong with this settlement, and how should the county proceed from here?
Well, let me start out by saying this. It was not a, there are some things that we got that we were pleased with in the settlement. The first among them, primary, is the fact that one of the non-negotiables at one point that One America was seeking was ranked choice voting, and that was a non-starter with us. We successfully got that off the table. As far as the settlement, other than that, you know, the fact of the matter is it was a lawsuit that was pursued pursuant to the 2018 Washington State Voting Rights Act. You know, I commented earlier that this was it's something that was passed by a Democratic legislator and Democratic governor, and when those laws are passed, sometimes they favor one political party over another at times, or have that intent, and I think there's some of that in this case. That having been said, it is state law. You know, we could have taken the course of the city of Yakima that they did several years ago and try to sue and spend several $1 million and lose anyway. You know, they did that without the Washington State Voting Rights Act being in place. The fact is that the current law is the current law, and whether I like every aspect of the law or not, it is the law. You know, that having been said, there are things that I don't have a problem running a district-wide race versus a county-wide race. I'm comfortable with that. I'm fully bilingual, and I feel comfortable speaking to you know, people of all ethnicities in our county. They are my friends and neighbors, and the one thing that wasn't mentioned when this article touched on this, or the paper touched on this before, was that I said that one of the things that I think One America is mistaken on is the assumption that all Latinos are Democrats. And that's simply, as my experience is, that's simply not the case. I feel that I, as an individual, and we as a party have principles that they believe in, family values, business. They have a very good, many of them have a very good entrepreneurial spirit. And I'm open and willing to have that conversation and ask for their vote. And I'm comfortable that I can do that.
All right. Ms. Torres, what would be your response to that question?
But going forward, I would like to see the county not just immediately settle with a lawsuit, but see if there is anything more that we can do to stand up with our current way of doing. I hate to see people divided. Our country is so divided right now anyway.
We're having trouble hearing you again.
Can you hear me? Sorry about that.
Well, you started out fine and then it kind of faded.
Oh, sorry about that.
All right.
I would like to see the county stand up for the county instead of just settling right away with these lawsuits or the threat of lawsuits. And also, it's sad to see our county being divided racially because we're all Americans. So I hate to see people come in and divide us that way. So obviously going forward, it will be a way easier time only campaigning in a district. But I feel like then the entire county loses out on having a part of voting for that commissioner as well. So, but it is what it is.
Okay. All right. Let's move on to
So Mr. Taylor, do I have 10 seconds to add a comment?
Absolutely. If you'd like, that'd be
Yeah,
fine.
thanks. And I would just say that, as we looked at this as as commissioners and as our legal team, we don't settle just to settle. We really took a hard look at this and we were willing to go to trial. But as we looked at all facets of the case, we thought, yeah, we could spend an extra $2 million and go to trial and lose, or we could save the $2 million for our taxpayers and reach a settlement that, although maybe it wasn't everything we wanted, we got some of the things we wanted and felt we could move forward and feel good about saving that money on the behalf of the taxpayers. Thanks.
Anything else on that one? Is that it? Okay. So the next question is, again, controversial question. Both of you have been skeptical of mask mandates for the COVID pandemic. If masks aren't mandated, what is your plan to get the community through this pandemic otherwise? How do we avoid overwhelming hospitals and trying to keep kids in school and their parents at work? Let's start with Ms. Torres this time.
I'm just going to repeat the question. So you said if we don't have mask mandates, what is the plan?
Yeah, what's the alternative? How do you maintain health? How do we keep businesses and schools going if we're not going to mask up? How do we do that without overwhelming hospitals?
Well, for one, the science with masking, especially our children, it isn't there. And I mean, you've all seen your kids touching their face and everything. So I don't feel like masking, especially the children, is going to help one way or the other. Focusing on individual liberty and the choice and educating people on behaviors that do reduce sickness, helping boost their immune systems. Let's use our health department to also get the word out about that. Right now, we're looking at a staffing shortage with our nurses because there's a bunch of them that are going to walk off their job or be fired because of the vaccine mandate. So that's going to put our community at a greater risk. So I feel like medical freedom is a huge issue right now with our entire community, and the balance of keeping our community healthy and keeping the hospital staff with, like I said, these vaccine mandates. I don't know if you've heard, but a lot of the nurses at Memorial, they haven't taken it and they will be walking off. So it's medical freedom that is the issue right now.
Okay. Commissioner Linde, how do you respond to that question?
Sure, thank you. And I guess since Autumn veered into the vaccine territory, I think I'd like to address vaccines and masks as well. You know, from a vaccine standpoint, you know, I've spent 15 years in a hospital. I've got a lot of friends of mine who are physicians and medical professionals, and I, you know, there's no vaccine that's risk-free, but this is from the information I've gathered, the vaccine is as safe as any vaccine we've had. So I do encourage people to get the vaccine. I did a public service announcement for the health district encouraging people to get the vaccine. That having been said, there are people that have risks and their concerns, you know, about it. And I encourage them, of course, to visit with their physician. And the unfortunate thing about the vaccine right now is that this has become, in the midst of this pandemic, it has become so politicized, and which is truly unfortunate. But I think but because of that, also, I think the vaccine mandate has been a mistake, and primarily for the reason that, as we look at our healthcare professionals and we look at the hospitals that have been overburdened right now, and to the point that there's so many COVID patients in there that we can't even do a lot of surgeries that people need, and other people are getting, you know, turned away at the door. That, as well as our teachers, where I know that our school districts are struggling to have substitutes to fill spots sometimes, and as well as our first responders, that I think the mandate is could backfire, because if we lose 5 to 10% of our staff, all those entities are going to be in serious trouble. Again, I encourage people to get the vaccine, but I think the mandate, unfortunately, probably was the wrong approach. Now, from a mask standpoint, I will tell you that with my background in healthcare, you know, masks must have some benefit because we use them in the OR, you know, and we use them in other healthcare settings. And so there is a purpose for them. My thinking on this, as studies have come out, and there was a time when you could accurately say that there have been no randomized controlled trials, which is kind of the gold standard in research regarding, you know, how valuable or reputable or reliable a study is. But recently, some medical professionals and researchers from Stanford, Yale, and can't remember the other university, but actually performed a study on widespread mask usage in the country of Bangladesh, and involved about 350,000 people, which is a pretty wide, it's a pretty big sample size. And they had control groups where some of them, you know, were not encouraged to use masks, and some they educated and actually encouraged them to use masks. And what they found out was that with the masks, they got about in the pro mask side, they got about 48% usage, and they saw about a 15% reduction in illness in that large sample size. So it tells me that the mask can be a tool. They're not all effective, and nobody has told me, including medical professionals, that it is a cure-all. It's certainly not the tool that the vaccines can be, but it could be a tool that is, you know, can be helpful, like the distancing or the hand washing can be a tool. But I do have concerns with masks, particularly in the schools, especially on the younger levels. As I look at, for example, I come from Sunnyside, and half of the students in our school district are Spanish speaking, and they come, you know, when they come into the schools, and they come from homes where English is not their first language at home. And I think, how on earth do you learn a new language when you can't even see someone else speak? So that truly is, you know, a concern. So I think in the schools, we really have to look at, you know, it's not that it's no risk for kids, but it's certainly a much lower risk than it is for older age groups. So we ought to be looking at other safety precautions other than the masks to help protect the kids and the staff. So that's a long answer to a short question, but I think the, you know, the mask may have some use. But I think the problem is right now is that the mask really, for some, has been a symbol of frankly, the government overreach. I mean, people after a year and a half of going through this pandemic and seeing its effects of really the effects of, having jobs lost and education ability lost and inability of churches to meet, that there've been a lot of things lost during that time, and the masks become a symbol of that, I think. And it's one way where people can say, no, I'm really tired of the government telling me what to do. And I think that's one reason we see the reaction in a certain part of the populace for that.
There's also equal amount of research that says the things that it can also be harmful. So harmful for children, their oxygen rates. Like I said, we really need to look at other ways to keep our community healthy. So,
Can you point us to that research, please, Commissioner? Candidate, rather, Torres?
On
that the masks are harmful for children? Because I'm not aware of any reputable scientific research that shows that masks are harmful to children.
I guess the psychological effects on children is very damaging. Having a little kid locked up for 8 hours when they can't see their teacher or their fellow students, that's very harmful.
And once again, is that based on psychological research or is that personal observation?
I have heard of psychologists saying that. I can forward that information to you.
I'd like to see that, please. Thank you. And both of you have referenced the number of nurses that are going to quit because of the vaccine mandate at Yakima Valley Memorial Hospital. How many? What are the numbers? What have you heard specifically?
I'm hearing, it could be up to 80 nurses.
And you hear that from whom?
The nurses. There's groups that have organized.
Okay.
From my standpoint, I don't think I could give you a definitive number of nurses or employees, but I am aware of people that are willing to walk off the job at the 2 Lower Valley hospitals, and I know people who work there, so I have some connections that have informed me that are pretty close to it.
Is it going to be a significant number?
I think it's not as large as first, as the initial feeling, was thought. I don't think it's going to be as large. I think the issue is that even if it's a small number, those staffing levels are already pretty tight. You've got nursing staffs and doctors, frankly, and as I go through the hospitals from time to time, and I've seen it on their faces. They're tired, they're worn out from this pandemic and taking care of these patients. I think earlier in the summer when our numbers were lower, they felt like that. I don't think they had an illusion that COVID was going away, but at least we got into a minimal or manageable level, and they're looking pretty worn out right now. So they're looking for options like traveling staff to come in, and so that's even I don't think it's going to be as large a number as was once thought, but it's still going to have an impact. And I can't speak to numbers at Memorial. I don't have those.
All right, and one final question. Operational, why would you want hospital staff unvaccinated and capable of spreading the disease either inside that hospital or outside it? Why wouldn't you want your staff vaccinated?
I think that's a fair question, and that's an argument that I'm hearing made by healthcare management. That, the counter argument that I've heard from nurses on that is that some of them say, I've taken the precautions that I've needed to over the last year and a half, and I haven't gotten sick, and why can't I continue to do that? And I do know this, that as I saw this, because I used to work at the hospital in Sunnyside, that after several months there before my appointment, any staff that were getting sick from COVID typically didn't get it on the job. They got it away from the job because they were in an uncontrolled environment. So that's their argument, and I can see that side.
And Candidate Torres, did you have a response to that?
Yeah. For one, people that are vaccinated are still getting it and spreading it. So there's a fallacy there, and it goes back to, medical freedom. If they would like to get the vaccine, it's very available, and they should be able to get it. And if they don't want to get it because of religious or medical exemptions, they shouldn't have to. We're segregating people by vaccine status now in America. You can't even You know, in Seattle, they're doing vaccine passports. So it's kind of tearing our country apart right now.
Okay, thank you.
I guess if I could add on just a little bit of that, as I've spoken to our medical professionals here in our local hospitals, and even some in the Tri-Cities and Portland and Spokane, you know, what I'm hearing is of the COVID patients that we currently have in the hospital, 90% of them are unvaccinated. And of the 10% that are vaccinated, almost without exception, they have a comorbidity. They have some other health condition. So it's not just that they're dealing with COVID, but another prior existing medical condition. The other thing we're seeing is that, and we see this at some of the larger hospitals. I saw some very interesting graphs that show, you know, some of the hospitals, for example, in Spokane, where they might have 150 COVID patients in their hospital. And out of that percentage, they might have, you know, perhaps 85% that are unvaccinated and 15% that are vaccinated. But then if you go the next step and look at who's in the ICU, you see that over 90% of the ICU patients that are COVID are the unvaccinated. And then when you look at those that are actually intubated, that are on a ventilator, 100% of those are unvaccinated.
That's
So
not true.
it's quite a,
I have
that's
friends
quite a story.
Let's give Autumn a chance to
Okay.
talk, and then we'll move on.
Okay. What you said about the 100% that are on ventilators being unvaccinated, that is untrue. We would need to speak with the nurses in the hospital, but I have heard differing stories on that. So I don't know if we can do a FOIA request on what the actual numbers are, but that would be good to do.
And I guess I would just say that I wasn't speaking to all hospitals, but it was a graph that I saw out of a group of hospitals in Spokane.
John?
Stay for the next question, John.
Yes. Okay. This one's a little bit calmer, probably. This is in the last few years, particularly, we've seen a lot of droughts. We've seen a lot of new growth coming to the county, and that's put a strain on our water supply, our water table. How should the county balance these increasing demands for water as our supply shrinks? And on that one, let's start with Commissioner Linde.
Well, you know, it's a complex issue. It's been an issue in the valley for decades. As a former farmer, I had land on senior district property and junior rights water property district, and I know what that looks like when it's when we're in a drought. You know, there are years when we had to sell our water rights because we didn't have enough water to keep the crop alive. And so, you know, I know that between the Yakima Basin Storage Alliance and the YBIP, the Yakima Basin Improvement Plan, it's been a decades-long process, and with collaborative efforts between all of the entities and interests there, they have made some progress, you know, but most of that has been conservation issues, which stretches the water farther, which is obviously a positive. It's also been something that's been beneficial for our in-stream flows, which is beneficial to fish, and, you know, keep maintaining a stable water temperature. The one thing they haven't got to yet, which we still have to address, is the issue of water storage. You know, we have talked about those other issues which stretch the water, but as the population continues to grow, we really need to have additional storage. I know that there are areas where this is being looked at, but we haven't arrived at a solution yet. I mean, I've seen some things on the drawing board, you know, that maybe could be accomplished, but it hasn't been, you know, we haven't arrived at a solution yet. So we're going to have to continue in that direction. You know, the other issue is the issue of the wells, you know, and that's, you know, a solution after some court decisions were handed down, was a solution that was arrived at by a previous board of commissioners. And it's, you know, it's an issue that's controversial, and the current solution or the current laws and ordinances in place aren't everybody's liking. I can tell you that one thing we can't get around is the fact that the state, through court law, and has been taken all the way to the Supreme Court, is that we can't issue new water permits without proving that we haven't impacted senior water usage. And so to drill those new wells, we have to be able to deliver a senior water right. And so, you know, at this point, the county has been able to purchase water rights to provide for that for many years to come. Still, there are things of issues whether where the county, I think, has maybe made it the current ordinance in the county a little inflexible. We need more flexibility to make it a little more user friendly for our users and those that you know have wells in place. And we also want to make sure that the grandfathering rules are firm there, and that those have had those water rights, that they keep that, and there's no controversy over that.
Okay. Ms. Torres, are you? We don't hear you again.
Okay. Yes, we need to work on increasing storage for our valley. It is a complex issue, and you know, from Grandview all the way to Natchez, working on ways that we can store more so that we can get through these droughts for our farmers. And then again, on the issue of the metering of private wells, that was done in haste. And I believe, and this is one of my main things that I'm running on, that it needs to be brought back before the people of Yakima County and mitigated what was done with the water utility. It's really not bringing our county any financial gain, but it is causing a lot of headaches for property owners. So I will be looking into that, if Commissioner, how we can bring it back before the people and mitigate what was done. And I would support repealing it.
Wouldn't that risk, you know, a situation like happened in Upper Kittitas County where there was a moratorium on new development because of some of those water issues?
I think we need to go back to the drawing board and bring all the stakeholders together. Kittitas actually did a better job of looking at what we have. And like I said, if we can't fully repeal it, let's mitigate it and make it more user-friendly for our Yakima citizens. Because it is a huge issue. Like we said, there are some people who should be grandfathered who've had difficulties. It's just been a huge headache for a lot of citizens. So I think we need to bring it back before the people and look at all the different stakeholders involved in it.
And I guess I could add on,
Sure.
if I could just add on a little bit to that, I'll say that, you know, we don't want to be in the position that Kittitas County was in, where they had a moratorium for an extended period of time where there was no growth allowed, new growth in certain areas of the county. We don't want to be in that position. You know, there are areas in the county where we're seeing a dropping water table, and we have to be cognizant of the fact that, you know, water is a finite resource. But, you know, as far as review, I will tell you that we as commissioners, we're already reviewing this. We're having these conversations with our public services department right now. We're looking at the ordinance and see how we can make that, you know, a little more user friendly, as I mentioned before, and fix some of the, you know, some of the heartaches where we can for our public. And we will open that to, you know, when we get that chance, we will open it up to public review and you know, public hearing, so people have that opportunity to make comment and give input.
It seems like though there's only so much water. At some point, you're going to be forced to make some hard choices, aren't you?
Well, and you know, and that's why we've done things. For example, we just made a recent water purchase here in the Yakima County of some senior water rights from 1869, which will give us the opportunity for several years to come, you know, that we have a solution at hand. You know, that we can say, yeah, we can offer senior water rights to anybody who's drilling those domestic wells.
Adam, do you want to add anything?
Okay. I wanted to kick it over to Phil real quick too and see if he has anything he'd like to add or ask about. Phil, you?
Yeah, I think you guys have, can you hear me? Am I on?
Yep.
Yes.
Okay.
You're
Yeah,
on.
you hit most of the points that I think we've been covering so far and that I've had interest in, but I do want to ask a little bit deeper on the water utility for the county. I covered that, I remember the inception of it. And I'm just curious, the concerns with folks that are having to you know, now participate, you know, for new development, rural development. What are the concerns or the problems that they're having? Specifically, what are you hearing? Whoever wants to go first is fine. What are the complaints, essentially?
So I've heard of a couple, well, several stories, but for one, they said, like going forward, trying to figure out the process was very cumbersome. You know, the fact that you're paying the county to come out and meter your own private well, you're paying for your water, they don't give you anything in return. It's the government taking. You know, it's not like the city where they're taking care of everything. You buy your private property, you pay to drill your well. Now you're having to pay for the county to come meter, you're paying for their time, and you're paying monthly. They're upset about it. I've heard people saying now they're trying, instead of wanting to build, they're looking for existing properties that are already built, which we all know our housing shortage right now. It's super hard to find housing, or we have a shortage. So I just feel like, I mean, those are several of the stories. Actually, October 4th, there's going to be a public meeting. Phil will probably be there. The Farm Bureau, the home builders, the realtors are putting it on for the citizens to come and tell their stories. So that's October 4th at the convention center.
Okay. So are they saying that, you know, what's cumbersome about the process? Are they complaining about the application process and all of the paperwork and dealing with the county in terms of getting to the point where they can get their well approved?
Yes. So
okay. That's in addition to the fees and all of that. Okay.
Does LaDon want to?
Yeah.
Yes, absolutely. Yes. And I would say that, yeah, and I've heard some of those same complaints, and and the only thing I would add to that is, well, yes, I think, prior to this ruling, they were still having to pay the cost of their own well and the permits. The part that's additional, and, I guess you could say more onerous, is the fact that now they're having to add a meter and pay for the, for the water that they're using. So that is an additional cost. So I think one of the things we have to look at is make sure that cost is not onerous. One thing I can assure the people, because I've heard this complaint as well, if this is just kind of the nose under the tent, and pretty soon they're going to require it of everybody in the county. And I will tell you that as commissioner, I have no intention of expanding it anywhere else. We fully intend to grandfather. I fully intend to grandfather those that already had that in place, so they don't have to worry about a meter. As far as the cumbersome nature of the complaint, I've heard that as well. And, as someone who spent 35 years in private industry, I will tell you that one of the things that we've been able to implement since I've been county commissioner is we're actually asking public works and public services, excuse me, to put in a customer satisfaction survey. We want to hear from the people that are using our process and learn, what things are going well and where we can improve. And it's been helpful to us. We're getting good feedback from our customers, the citizens of Yakima County. And some of them have been easy fixes that we're working on, and other things that may take a little more time, but it's great, it's great to get that feedback. So it's something that it's something we'll continue to work at. I think continuous improvement is something that when I was in healthcare, we always did that. We had meetings where we worked with the medical staff, and these are very educated people. They spend a lot of time going to college and getting their training, but yet we would have these committee meetings where we would say, okay, what can we do better? And I think it's a good model, frankly, for anyone to use to see, how can we provide better services?
Okay, just two points of clarification that I wanted to make. And one of these, there may be something I have yet to hear, but first of all, from what I recall historically, rural domestic wells, because of the, amount that a household would require to use, they'd always been exempt from permits. So if somebody was going to build a home out in the rural area and drill a well, they were always exempt from the permit process. And I had not heard anything about the water utility or possibility, and this might be new, of anybody wanting to go back and try to get somebody to charge the usage fee that was already in prior to the water utility. That was one thing that former Commissioner Mike Lade made a big deal about. Unless there's new talk, but I do remember when the water utility was established, it already had clarified that folks that were in before the date that the water utility took effect would not be assessed.
Well, I guess, Phil, I would just say that
Discussion?
that is correct, and they're not being assessed.
Right. Okay. I just didn't want to confuse readers that there might be something brewing and that you were battling against it that actually may not be occurring. So thank you.
Yeah, and I would just
think
add
that's
that we want to make
pretty
sure
much
that as many
everything.
people aren't assessed. We want to respect those grandfathering. If somebody has a concern that they don't think that right's being respected, we want to hear from them.
Okay. All right. I think that's pretty much it. I'm pretty comfortable with everything else. I appreciate it.
Okay. At this point, I guess I'd like to turn it over to each of the candidates one at a time to take a few minutes just to kind of make a concluding case for yourself. We'll probably just, I guess I'm not going to put a big time limit on it, but probably about 3 or 4 minutes at the most would be a good range to shoot for. So why don't we wrap it up, and I'll start with Ms. Torres.
Thank you again for having us today. It's so great for all the citizens to get to be educated on who they're voting for. I will say I was born and raised in Wapato, and I grew up in the Lower Valley. I grew up in an agricultural family. My great-grandfather started a fertilizer company in a little town called Brownstown, Washington. And so I grew up being around agriculture. My husband and I have 5 children, and we own a general contracting company. I'm very passionate about individual liberty and protecting that businesses, helping them.
Kind of fading out again there. Sorry.
Can you hear me?
Yeah, you're fine now.
Okay, sorry about that.
That's all right.
I'm passionate about helping businesses recover after this last year. We saw a lot of horrible effects of these shutdowns. And my hope is that Yakima can fully recover and come back, because Yakima is where I live and where our children and grandchildren live. And I'm excited for what is ahead for Yakima. We do have challenges with our safety, our crime right now, our homelessness. There are issues to tackle, but I know we can together as a community come together and press ahead and work together for a better Yakima. So I'm excited for that. I'm the only candidate running that currently owns a small business. I've been endorsed by the Home Builders Association, the Farm Bureau, and the Yakima Association of Realtors because of my stand on property rights, among other things. So I would appreciate your votes November 2nd. And again, thank you guys very much for your time. I really appreciate it.
And Commissioner Linde.
Yes, thank you. And I guess I would just start by saying that on the endorsement side, I've been endorsed by the Yakima Valley Business Times, as well as Senator Jim Honeyford, Senator Curtis King, Representative Bruce Chandler, and Representative Jeremy Defoe, as well as city councilmen and women and school board representatives, many people from the healthcare field, and business owners and leaders and education leaders throughout the county. On top of that, though, let me just mention that I think that aside from COVID, and of course, it's a big deal because it affects us in so many ways. I'm hoping to get to the point where nobody cares about the health district again. But until that time, I will continue to work to defend our businesses, schools, and churches. We have had, although I do take issue with some of the governor's emergency edicts, I don't think one man, governor or leadership is the way our system is supposed to run. However, I am happy about the fact that we actually have all schools in Yakima County having in-person education right now full time, which we haven't had in a year and a half. It's, that being teaching by virtual has done tremendous damage to the education of our kids. And so I appreciate the efforts of our school districts and the health district in helping to make that happen and keeping that as a goal, that we keep those kids in place. Glad to see that our businesses are open and that we don't have occupancy limits. And so, and our churches are open and we don't have occupancy limits. So I am happy to say that I think that is a step forward, a pretty big step forward from where we were 10 months ago. Other things besides COVID that we're working on as a county. One of the things that we're looking at right now is we want to put in place a countywide radio system where for our first responders. So this is fire and ambulance and law enforcement. One of the problems that we've had that has come to the forefront is that if there is a mass issue where we have several different entities coming together, that our first responders have difficulty communicating with each other. So we're early on the process, but this is a goal of ours to make this easier for those that protect us in all those ways, so that they can talk to each other easier, particularly if we get some kind of mass casualty incident. Other things we're looking at is an ambulance RFP, so that in much of the county we can improve the service times. This is, Sunnyside and Grandview have a pretty good system in place with the fire department down there, but the rest of the county has an issue in that if you live in Yakima, close to Yakima, where the high volume is, your response time is pretty good. But if you get into other areas like West Valley and East Valley, and certainly the Lower Valley and the reservation area, those response times are not as fast. And when you talk about real emergencies, those minutes sometimes mean lives, the difference between life and death. So we're continuing to work in that direction so that we can bring faster ambulance service and hopefully more cost-effective service to the citizens of the county. Aside from that, I will say that, I think aside from COVID, really the biggest issue that we have in our county is the drug abuse issue right now. I see as someone who had experience in healthcare, I saw it in our hospitals. As a commissioner, I've seen it impact the homeless population, and I see it impact our jails. And we see that over 80% of our repeat offenders in the jail are there for a substance abuse issue. And I'm not talking about possession. I'm talking about property theft. I'm talking about domestic violence, and I'm talking about violent crime. So it's something that we're going to have to continue to work on and address. Some of the rulings from the legislature last year have made that a little more difficult. So I'm hoping we can revisit those in the next session. But those are among the things that I'm committed to work on, as well as with my over 30 years of working with and managing people, departments, budgets, and organizations, that I think that's a good fit for Yakima County. And I think we can work to continue to make the county more cost-effective, place of business where we are more responsive to our customers and provide services in the most economical and effective way possible.
All right. Well, thanks to both of you. We appreciate you taking the time again. Enjoyed speaking with you both. And for the record, this has been the Yakima Herald-Republic's editorial board meeting, which features Torres and LaDon Linde, who are seeking the District 3 seat on the Yakima County Commission. So best of luck to both of you, and I will turn off the machine.
All right. Thank you very much.
Thanks.
Thank you.